All right, here's my room scan. And those are just the doctor's orders there. Come in. Hi there. My name is Allie. I'm going to be your student nurse today. Can you tell me your name and date of birth? Joe Smith, 12/10/5/51. All right, Joe. And do you have any allergies? Sulfa. All right. Well, we don't have to worry about sulfa because I won't be doing much with that. So we have doctor's orders stating to put in a NG tube for you. Does that sound okay? Yes. All right, and I will walk you through everything, so don't worry about that. First, I'm going to get you into high Fowler's position. So you want the bed to be about 35 to 40 degrees. Then I'm going to assess your nose. Have you ever had an NG tube in? No, I have not. Okay. So I'm just going to look in your nose, make sure if there's any like obstructions, and looking for any like inflammation or anything in there, looking in your nares. And I'm also going to have you verify patency, so have you close one nostril, breathe in, and then the other one. Perfect. Will sound good. I'm also going to verify your gag reflex to make sure that you're not at risk for aspiration. I'm going to get this clothing protector on you. I'm also going to get my stuff kind of set up over here. This is your NG tube that I'll be inserting. So now I'm just going to measure you, okay? So I'm going to measure from the tip of the nose to your earlobe. And then, hold that down for a second, down to your xiphoid process. Up here. And I'm going to mark that with some tape. Mark it below. Okay. So then I'm going to warm this. I would warm it in my hands, or I could get some warm water to warm it up. So Joe, I have some water for you. And I also have a tissue because it may be a little painful, so your eyes may water as well. Your water, once I'm inserting this in, once you start to gag, I'll have you drink some water while I keep inserting it in to help with the gagging, okay? I also want to make sure that this is plugged here, so none of the gastric contents come out. All right. So I'm going to lubricate this using some water-soluble lubricant. Get that nice and lubed up. All right, I'm going to go through your right nostril, okay? gag. Here's some water. Drink, drink, drink. Good job. Keep drinking throughout the entire time. You're doing well. Kind of lean forward a little bit here. Put your pillow down, and I want you to kind of hyperextend your neck. Make sure it's not coming out your mouth. Good job, Joe. All right. So we're to that point. So then take this tape and I'm going to secure it to your nose. If you had oily skin, I'd make sure to wipe down your nose to ensure that the tape sticks. To secure this here. All right, so that's good. I'm also going to make sure that I secure it onto your gown. Okay. Tears. Good job, Joe. So now what I'm going to do is I'm going to check the placement. So I'm going to clamp it here, pull this out. I'm going to pull out a little bit of gastric contents to test. I'll go right in my basin. And then I test it using my pH strip. So I want the pH to be between 1 and 5.5 because it's acidic coming out of the stomach. That's what I do there. So then I'm going to hook him up to suction. And then it would be like low intermittent suction is what is on our doctor's orders. So put it to intermittent and I want to turn it on. And then I could lower the head of the bed or wherever he's comfortable, move his pillow back up to the top of his head. Are you comfortable, Joe? Yes, okay, sounds good. So then to discontinue the NG tube, I need to stop the suction. Discontinue that. And plug it so then the gastric contents don't come out. Okay. And also get new gloves for discontinuing, obviously, because I want to put it in and discontinue it right away. So then I am going to kind of disconnect it from him, from my patient. Take all the tape off, careful not to pull. So then what I'm going to do is I'm going to take 15 milliliters of air or water, saline, and I'm going to hook it up NG tube. Okay. Then as I pull, I'm going to slowly insert this in. Joe, I'm going to need you to take a deep breath and hold it in as I pull it out, okay? It'll take me just a couple seconds to pull this out. So I'm going to put in the 15 of air. I'm going to slowly and gently pull out the NG tube. You're doing great. If you need me to stop, you just let me know. Alright, so I have the NG tube out. Fold that all up in my gloves. And I would throw that away. Alright, Joe, you did awesome. Is there anything else that I can do for you while I'm in here? Nope. Alright, so I lower the head of his bed. Make sure his pillow's nice. Alright. Thank you.